going over once again some of the things I've talked about really recently, was basically fruitful research terms. It's hard to know what you want to look for when you're looking for a information, but a systematic review on blank, meta-analysis on blank, role of blank in blank, so role of acne in post-inflammatory hyperpigmentation, role of acne in depression. All these things can give you very informative information, or can be very informative information. Negative feedback of stress and diet, for instance, the pathogenesis of P. acne bacteria, the mechanism of action of some active ingredient, benzoyl peroxide, something, a review of anything, the brain-gut axis, the spinal skin axis, the butt brain axis. These are all terms that you can use to really get something of substance, and they start linking, and it's really fun to get into. The histology of acne, the histology of skincare, all these things can get very influential. The efficacy of blank, the clinical relevance of blank. Experiment.com can be a load of interesting research and ways to basically go in and help fund evidence that's going on. I think I'll talk more of that and show you a brief synopsis of it quickly. But another side note is that some of the things that separate the common folk from an experienced expert is the fact that they can just simply note the name of the research paper that they're talking about. They can note the author. They can also say the journal. If you can say in the Journal of Nature, or in the Journal of Nature, Mark Cuban wrote about the acne-genic capacity of basketball in the Mavericks. You can, and that doesn't sound smart at all, I'll be honest with you, but that's what they'll say. They'll say those tidbits of information, and all of a sudden it sounds like they know exactly what they're talking about because they can accurately reference it. But it doesn't necessarily mean that that paper is saying just that. It just gives whatever they're saying added weight. So until you review that, you can sort of still work out a certain degree of sensitivity. So don't believe anyone who can just say that. At the same time, if you want to be respected, that's some of the information that you need to know. Where are the doctors? Why aren't doctors creating new therapeutic regimes, and why isn't this like a mainstream thing? Well, one thing is that they're overworked, undereducated on the subject. They're in fear of lawsuits, and they're bound to certain guidelines. Once they overstep the bounds of the guideline, then people start to question whether or not that new treatment regime is adequate. If you start to saying, hey, drink, I'm not saying to do this, drink a whole tincture of cannabis oil and you'll get rid of your acne. Not saying you should do that, don't do that. That's a risk that they may not be willing to take, and this is one of the things that's impeding the progress. I'm not saying that necessarily we need to go ahead and do the most radical things. I think doctors should be very cautious, but at the same time, if someone comes to you with an idea that something could be helpful, you should be open to working with them in processing that into a real regime. So how can you evolve your relationship or understand your relationship with your doctor? One thing you can do is you can bring in photographs of um, a month plus before to review. So you want to basically have an ability to understand what your condition's like and how it's imposed on you. Um, Mark the bad days and the good days and verify the dates. Once, if they can notice the ebbs and flows, then they might be able to be better able to treat you. Especially if you present photos, they're more inclined to stay with you, which is a big thing, is getting them to stay. Unfortunately, also, understanding the doctor's point of view is something that the the patient needs to do just as much as the doctor needs to understand the patient's point of view. So, like some cancer cases, remission is not seen as a practical or achievable goal outright. So if you're 15 and thinking that you're trying to get rid of your acne into basically nothing, and you've gone to 6 other people, that other doctor may not see you as, a success story. If you're clear, that's definitely a big success story, but basically their idea of the success story is that you have gone down from, let's say, severe to mild. If you've made that sort of grade difference, then they can say that's successful. Whether that's your idea of successful is something that you need to be open with your doctor. What kind of results can I expect with you? They hope to help you whether the thing is that most medications will give about a 50% reduction, roughly. Well, they can, with the right therapy, and that's generally considered a success story. It's not necessarily based on the grades that I've talked about previously, very early in the lecture, but it appears to be that doctors will reference that, if we can get a 50% reduction, that's okay. So, what they're doing is they're helping you weather the storm, managing the condition, not necessarily curing it. So if they can help you manage it, that's okay. They're just trying to get you through your teen years or what have you, specifically. So you need to make sure that you're putting the right pressure on them in order for them to understand your condition. So express why you're here. Demand more than just 5 minutes of their time. Don't let them just dominate the conversation. Be ready with questions. If you have questions, then they have to have answers. That's what they're there for. If you keep asking questions, they are more or less obligated to answer them. So if they're not suiting your needs, ask for recommendation of a colleague. Say, I understand that you're really busy at this time and it doesn't seem like you're interested. Do you have a recommendation that I can go to with someone who is more inclined to answer these specific questions, or more educated, and try and not be so malicious about it. Don't say that, hey, you're not good enough for this. Just try and see if they have recommendations. Some people have many different outlets, and that's what they rely on. If they realize that, oh, this is a skin scare condition, I thought I could treat it, but apparently this kid is really beyond me, so I'm going to go ahead and hand it off because that's what he really wants outright. That's okay. They're open to that. Ask to go beyond the standard guidelines. If you present them with a therapy which you've had, and if you present them with, let's say, some of the acne guidelines, and say, how are you going to do this better, or how are you going to do this differently than what I've had before, then they can win you over. And if you have a brief moment with them, then that's how you can select your doctor. You don't need to select your doctor by giving them a shot for 6 months and your money for 6 months. You can see them for a day, say this didn't work out, and then go to another one. And then keep asking questions and waiting for the person. You could maybe go to 3 or 4 doctors, 5 doctors, until you find someone that this is someone who's empathetic with me, this is someone who understands me, this is someone who has the time for me. Understand that, give them the powers of their position. They have the ability to change the world, or at least yours. Let them know that. Give them your faith, basically. Don't be, I'm saying being skeptic about them, but at the same time, don't be to the point where you feel like they can't help you, because that's never a good relationship. Whenever you're trying to solve a problem, if one of the parties is a very pessimistic or a jerk, it's very difficult to solve a problem. The idea is that this is someone you're going to help you. Give them everything that they need, and ask them and empower them with the ability to change your life. The role of a skincare professional. The role of a skincare professional is somewhat like a teacher. You could, in theory, grab a textbook and read the textbook, and then you would have that information. Or you go to a school and you get taught that information. But what does it mean to get taught versus what does it mean to read a book? Being taught is an interactive approach. It's a working relationship between a student and a teacher. Again, just like the student and teacher, you're working with your doctor. Like I said, it's a cohorted relationship. So what are they there for? How can they better your condition instead of you taking the same medications and saying, hey, I'm going to take it from here? What can they do better than you can do? One thing is that they can probably help you do is help avoid side effects. They can make individual assessments based on their experience. They can record quality of life measures with specific things. You could also do that, but they can have a third party perspective. They can seek innovative approaches, ones that, again, their experience can allow them to make more motivations towards them. They can work with you on certain elements. They can monitor the condition, and they can also report improvement in success rates. So that is what a skincare professional should do, and this is what their role is in removing acne from you and also improving it for the totality of society. This is what they should be doing. They need this sort of record keeping, and they also should have the ability to anonymously be able to publish some of these findings if you're okay with it. So, with something like improvement of success rates, if some clinic has, a 99% success rate, I don't know how, but 99% success rate with acne, that should be able to be looked at and say, what are these people doing differently? How are they doing differently? And is there anything that other clinics can copy to get these results worldwide? So, just like you shouldn't have a teacher just say, here, read a book. That's not what a teacher does. A teacher gives you interactive experiences, asks you more directed questions that are individualized for you, and helps to comprehend the frame at which you understand the world, your interpretations, and the teacher actually walks you through to the progression of that total comprehension of what it takes to understand something. If you need a specific metaphor, or if you need something that's more relatable, let's say that someone can't understand why a certain certain number is that high when you multiply it. If they need to use kittens instead of dogs because somehow they understand that better, then that's what the teacher will do. Just the same, if they say if you take 6 dogs and you take six um, 6 other dogs and you multiply them, then you'll get how many dogs. And if they understand that better than cats, because they can visualize it better because they like them, then the same thing can be done with a doctor. If they understand certain information but they're not getting it, and they can see that, they understand that you're not, practicing what you're asking them, what they're asking you, then because they should be able to tease that out as you work with them, then that's what they should be capable of doing. What are the questions you should be able to answer now? Can the sun make my acne worse? Better? Can exercise make my acne worse? Can diet make my acne worse? Stress? Pre-workout? Football? Boxing? Does it get worse before it gets better? Does acne mean you'll die early? Steroids? Insulin? Does it mean you'll get skin cancer? These are things that you should have a rough idea of being able to answer now. Something that's fairly difficult to still understand is why my back and not my face, or vice versa. I gave certain elements of a diagram of what certain environments of the skin are in those specific areas. I actually even talked about pore size, but another thing could be things like shoulder pads, a barbell, scratching, picking, certain the T-zones, the sebaceous glands are hyper-excreting those specific areas. The sebum composition is different for that specific area. Homing immune reaction. Basically, you have the immune cells that are attracted to your face because of certain different chemicals, then they're attracted to your back. So that's where you react. So if you might be allergic to milk versus something else, and that may cause you to break out on your back opposed to on your chest or on your face. And that's individualized from person to person. So you could have acne on your jaw, which is hormonal. There's also, again, skin differences within specific regions. It's really hard to say why when you, let's say, you drink milk and you eat, a boatload of bread and you have an energy drink, why it seems like you get all your acne on your back and why you have a clear face, or vice versa. That's something that's very interesting and difficult to discern why the reaction is happening specifically there. But it's probable that physical contact is having a strong role in that. Meaning, because you've disrupted the area once, because maybe you picked a really big pimple once, and that spread the bacteria, and that sort of was opened the gateway to the cascade. That may be the reason for why the area is so bad, even months and years later.
So what are the symptoms of acne? Well, it's something that we certainly need to comprehend. If we're going to be able to understand, treat a disease, or treat yourself, you need to really understand what you're going through and look for the certain elements that are affecting your life. One of which is erythema, or redness of the skin. There's itching, there's dryness, there's tightness, there's pain, like actual pain whenever you're trying to lie down or maybe do something physically active. You have pain that is preventing you from doing that. You could have just a sore face in general, something that's difficult to touch even, and that can have a huge influence on what you do with your life. There's psychological elements, which are very extensive. Low self-confidence, trouble sleeping, irritability, all those things begin to compile on each other. So whenever you're trying to treat acne, you're also trying to treat all of these other factors that go into making acne worse for an individual than for someone who doesn't have acne. So we currently have a fairly basic ability to address skin issues. You go to a dermatologist, they look at your face, they tell you what you need, what you should do. There's general rules and practices as far as, moisturizers and basically checking oily skin. Some of those things they don't need highly skilled people or special equipment to do or assess. However, I think there is a great deal of benefit to having a computerized visual depiction of your skin and maybe some of the deeper elements that are not visually apparent. So this is a Visia skin analysis machine which can assess using a couple different light penetrating tactics to it assesses the moisture in your skin, it assesses the severity of let's say either sunspots or acne like we were discussing. So there's also another element which it can take a 3D picture of your face as well. Not this model, I don't believe, but in another model. And this would basically allow you to rotate and have a patient's or your own face and be able to analyze it in a digital world, which is, I think, a really cool element and could end up having certain high degree of benefit. But as of right now, I don't feel like the technology has the accuracy that it needs. I think it's the right direction. I think it's a step to the future, but I don't believe right now that this is what we need. What I'd like to see is a higher degree of accuracy regarding what really necessarily a healthy skin is, especially for the individual, and then an automated regime based on the data that's being produced from these takes. Let's say you have in your bathroom, in the future, not now, but in your bathroom you have this technology, and every morning or so you go ahead and you take yourself a picture, and then it would then print out the regime for you. Or even beyond that, maybe you put your face in there and it has a topical treatment set up in a spray, and it just sprays your face as you close your eyes, and then you're treated for the day. And then you go out, and then you get reassessed at the end of the night, and then you get sprayed again, and then you go to bed after your showers or whatever. That is what I think would be great for the future. But as of right now, where we are, it's helpful, I think, but it's not necessary, unfortunately. Soon, I hope that we'll have something of that value for dermatologists to use and for individuals. So this digital skin assessment revolves around the vascular structure. So it looks to see what impact vascularization is having in its variations throughout the time course of a lesion. So this is supposed to be acne or a pimple. However, it looks to me like it's more of an ingrown hair. That said, we can see that there's seems to be a tick and talk to this state. So on day 1, there's a high degree of vascularity. On day 3, there's a lessening of vascularity, as noted by the increase in number of gaps. Day, I think that's 18. Day 18, you can see that there's a much higher degree of vascularity, and then by day 30, it's now almost remit. So there's like I said, a tick and talk. So you have a whole lot of inflammation, which gets the neutrophils and all your other excitatory molecules in the area. Then they start to chill out, and then there's a clearance of them. So, and then eventually there's a restoration to the original state. I think it's really interesting, and I wish we'd have more data like this to represent what the time course of a lesion is, and if we can figure out basically how a acne lesion naturally is self-eliminated, we can work with that structure and that functionality, biological functionality, and hopefully speed it up. So right now we use certain methods as far as antibacterials, we use vasoconstrictors and other elements, but maybe by understanding what the body's trying to do rather than trying to do our own thing, we can better treat patients and ourselves. So keep in mind, even after acne, you may be faced with another struggle. You may be faced with rosacea. You may be faced with seborrheic dermatitis, which could be yeast-based in reaction. However, there's probably something more, just like there was something more with acne. And you could also have something like chicken skin, or it's sort of like pocky skin that you see in people's arms or maybe their thighs. This has not the same, I would suggest, but has a very similar effect that acne has, and it just would be really unfortunate if you had clear skin and then you had rosacea or seborrheic dermatitis or chicken skin, which is taking away from your acne-free skin. So the idea here is to motivate you in understanding more dermatological diseases in order to give you the best chance of having model-esque skin. So if you'd like further videos on these skin diseases, you can try and motivate me with your comments, with your criticisms, and hopefully we'll be able to get around to it, because I got a lot of things I got planned for these videos. So here are some general suggestions. Fruits like blueberries, pomegranates, and tomatoes, and veg like sweet potatoes, baby carrots, baby peppers, celery, cucumbers, spinach. The more you want to keep more veg and more fruits you want to keep more veg than fruits in your diet, and keep out the fiber so you can feed the good bacteria. You want to drink 2 liters of water throughout the day, not all at once, so not right before you go to bed. You should take a B complex, basically not more than 100% of everything. So you don't want 300% B3 or 150% B12 or anything even 8,000% B12, which they do sometimes. You just want a B complex for everything. Now you also want to take vitamin D, about roughly 2,000 international units in the morning, and then zinc, magnesium supplement at night. You could just stick with zinc too, though. You don't necessarily have to go magnesium, because some would say that can create excessive bowel movements. So you want a multi-strain probiotic like a Floragen 3. So you want to keep minding the kind of bacteria that's in your gut, the delivery, the number, how lively they are, their vitality. You don't need to take the supplement every day. I'd say every 3 or 4 days is okay, because that's the time frame at which bacteria can generally remain in your intestines before they move out. You want to wash your face maybe twice a day during summer, maybe once during winter, keeping mind of sweat, physical activity, skin tightness, and dryness. So if you have a really oily skin during the summer, you could maybe wash your face twice a day, not including your daily shower. You don't want to wash it excessively, and at the same time, you don't want to leave your skin after a workout for 6 hours, or whatever you're going to work out for. If you run for 2 hours at a time and you're sweating profusely, you want to either take a shower or you want to, for the very least, wash your face after such activity. So you want you don't want to wear something like during when you're exercising. You don't want to wear something like uh, a tank top or something that reveals a lot of your skin. You want to wear something like a whole shirt basically. So when you're squatting or when you're doing those others, or when you're lying down at a bench, you're not mixing and commingling with um, other people's oils, secretions, and bacteria. Um, you want to eat a low glycemic load diet. Um, you want to try and keep your glycemic foods under 50. So anything over 50, again, can be perceived as bad. Um, you want to avoid stimulants, chocolate, caffeine, avoid excessive B6 and B12 in particular. You could try and use more niacin. I said 100% of each complex, B complex. Well, you could try and use a little bit more niacin or B3 to raise your HDL, but I wouldn't say you'd want to go into a state where you're actually having the niacin flush. You want to avoid milk down to less than one serving every 2 weeks. In particular, avoidance if you feel that you're allergic to it. Or having an allergic reaction. So find your allergy, look for other signs of ill health. Eczema is one indicator. So if you may have some other ailment on top of the fact that you have acne. This is not necessarily proven that an allergy means that you have more than one issue. However, there are many instances where someone may have, I feel, well, anecdotally, I have had this issue where I had eczema on my elbow and acne on my face. I removed milk, and I could see that the eczema cleared up, and so did my acne. So I correlated that with an allergy because that seems to be the case. So if you have a lot of ailments, one thing that may be you may be being insulted with a allergen. So the other element is you just try to avoid the top allergens and then work your way down from there. So you want to try and shower before bed. You could try and use like an oat bar on your face, but I really would not even try and use anything on your face. Particularly, you don't want to use any soaps or things with fragrance in them. You don't need soap in order to make your skin feel clear, and you also don't need a cleansing wash or anything. That's basically just stripping the oils from your skin. Water does just fine for removing the vast majority of oil on your skin, and still keeping the oil that is helpful, so your skin doesn't feel like a desert. So there is also the fact that you need to change your pillow roughly every 3 days. Um, you could go maybe a week, but if you have a lot of pustules and ones that are, that just bursted when you were asleep, you want to try and remove those that pillowcase as quickly as possible, because even though the P. acne itself may not still be alive, which it could still be, you also have the cell walls that can actually cause the reactions, and influence the skin in order to cause acne lesions. So you want to try and remove as frequently as possible those elements. Uh, Roughly 3 days is fine. There shouldn't be any crazy buildup. Now, the other element is that you want to maybe try something like an epiduo, which promises about a 30% clearance rate. So they're clear, meaning that it's not that they've improved. Just 30% of people actually have clear skin, which is one of the best I've seen, and with the fewest side effects. You could develop an ideal situation on top of the regime I was talking, or the skin analysis I was talking about before, to have clear skin, is that the world develops a computer model that takes protein folding, transcription, base genetics, polymorphisms, all that into consideration, loads it into a computer with big data, and prints out what you're going to have and predicts you and can basically give you a successful skin regime. But because there's so many different factors that weigh into how the skin reacts, we can't predict it. The only way to predict it is with that level of data, which we won't have for a very long time. You want to try and do your best to do the more epigenetic, or and you want to try and get the larger picture by trying to understand, general risk factors, age, breastfeeding, pore size, stress level, those elements, and your dietary regime. You want to try and look at those elements and maybe stay away from looking at things like how protein folding and transcription factors influence your skin, because those aren't day-to-day things that you can change unless you're going to basically develop a product. You're going to want to try and stick with these general guidelines. The other thing to keep in mind is that the time frame that it takes to improve is 2 weeks, which is generally, I feel, if you're just going to be removing an allergen, that's when you'll actually start to see something, to 12 weeks, which is 3 months. So if you do something, you're probably going to take that long. So what are the foods that we should not be eating? Well, as you can probably tell from my other slides, dairy is a big one. You should not be eating dairy. Bacteria is one reason. Testosterone is another. Testosterone facilitators is yet another one. We have insulin. We have a genetic component, or allergenic component to dairy. There's higher levels of iodine in dairy due to the iodization of the teat as it is used for disinfection of the cattle. And then you have immune cells and molecules that are being inputted in you from the cow, which can cause unknown side effects, and lactose, which is a milk sugar. I mean, all these have some element that either yields them a risk or a potential risk. So really, I mean, it's not to say that any one of those, some of those things are really outstanding, like immune cells, whether or not that's a really outstanding fact of dairy that causes issues. But the insulin, the hormonal component, and the allergenic component are huge. So just use those other references as basically just additive. So we have stimulants like coffee, chocolate, any caffeinated product or pre-workout, vasodilators like nitric oxide. These are things that can cause exceptional flushing and higher insulin output, or I should say testosterone output, and potentially also insulin output. And they also come with high levels of exceptional, at least in the instance of pre-workouts and energy drinks, they have high levels of B vitamins, which can actually cause issues with the skin as well. High glycemic foods, this is another huge one, and basically, things, any food that contains, a grain basically is going to be a high glycemic food. Now that's a gross generalization of it, but you should try and keep that in mind. Anything that's like a dried grain good is probably going to be something that's going to be high glycemic. Although you can also use that reference table which I've put in earlier slides. So greasy foods, not necessarily from a concept of what goes in your mouth, but also from a concept of what goes on your hands and then on your skin can cause issues. Pastries, that's just, it combines two terrible things. It combines dairy and it combines high glycemic nature. Generally that's what a pastry is. It's sugar and butter. So refraining from pastries is a big way to make strides in clearing your skin. So trying to not eat anything that has an allergenic component for yourself. That's easier said than done, but so these sort of intolerances need to be tracked. So just looking at your consumption patterns is a key part of trying to ensure that you're not eating something that you shouldn't be. Refraining from processed foods is a good idea because of either preservative disruption of the gastrointestinal tract or the biome. Basically, is the gut biome. Bacteria could have side effects. I'm not going to say that all processed food is bad, but it's certainly eating a more whole food diet is something that would be helpful for a multitude of reasons, and one of them being because of the general nature of processed foods and how it removes fiber and it increases glycemic index and increases bad fats and added preservatives and antibiotics, things that can affect your gut biome. So foods with high dioxin content, chicken, red meat, those are things that you want to try and limit to some degree. You don't want high levels of dioxin, although the amount of dioxin you would need to take in to really have an exceptional effect directly on and cause chloroacne seems to be very, very high, something that you can really consume to that level. Reducing dioxins is good for cancer and a multitude of other things, but also we don't know if those chemicals, just like minocycline potentially affecting and causing an autoimmune disease, we don't know if these dioxin chemicals are potentially influencing allergies. So we want to try and limit them from that other aspect, the unknown aspect. This is trying to cover all your bases without really limiting you. And hopefully you'll be able to do that with the more, you can probably be super strict in the beginning and then gradually loosen these up to a more livable standard, so that you can live your life with a degree of normalcy, opposed to honestly always being obsessed about your skin and whether or not a food's going to break you out. So there are many apps, and some of them are good, some of them are not so good. One of the not so good apps is blue light apps that suggest that you hold your phone with next to your face with blue light on. As I've discussed before, you need a certain amount of light transmitted at a certain frequency and a certain level of strength at a certain concentration per inch and at a certain rate as well. So all of those things need to come together in order to actually have a therapeutic effect, and blue light from your phone falls short of that. Now, the other thing to keep in mind is that you may have a dirty phone, so having a phone with oils on it from either the last hamburger that you ate or cheeseburger or something. Hopefully you're not eating cheese, but um, you should also take in consideration, you want to have a clean phone before you're trying to even put it anywhere close to your face. Um, Now, you should also technically not have the phone any closer than 5/8 of an inch away from your skin. This is according to Apple. So if you have an iPhone, if you've considered whether or not the phone affects your health, keep in mind that 5/8 of an inch is roughly about a half an inch, is about as close as you want to have your phone to your face to stay within the Apple's recommendation. Now, what are some apps that are actually good? Asking your dermatologist about Acne Track is not a bad idea. It's used to keep communication with your dermatologists. So, dermatologist, I should say. Now, this added form of communication can be very good for therapeutic effects. It can also help for prompt earlier visitations and alterations of an acne regime. If someone gives you higher strength isotretinoin, and then all of a sudden you have crazy peeling, but the doctor you're just doing what the doctor told you. He doesn't know exactly what's happened to your skin at that moment. It's not to say that he is dumb. It's to say everyone's that is different, and he doesn't know how your skin's going to react. So getting continuous feedback on how your skin's reacting, he can adjust the recommendation of the dosage more regularly than, let's say, once a month. Now, there's also another alternative. It's an Epi tracker can be used as well. There's also a study that you can participate in, which is called Diet in Acne. These are all on Apple, in the Apple Store. Now, there's also ScanZ/My Skin. These are suggested to predict the life cycle of a pimple. I love the idea of this. I'm not too sure it actually works very effectively, but maybe with some stronger advancements, it can actually, once you take a picture of your skin based on your past history of a pimple that has the same analytical measures, it can actually tell you, okay, your skin's going to get this much better after this much time using this medication or doing these sort of things. So you can have a better interpretation as an endpoint for each pimple, which gives peace of mind. It's not therapeutic in nature, but it may improve the quality of life because you can figure out when to schedule your date, basically, or something like that. So there's also something that occurs when you are assessing your skin. So under certain light, your skin will look different. What this other app does is basically it uses a colored circle that is used to calibrate the picture so it understands exactly what it's looking at in reference to these other circles, and then that is done to characterize your skin. So now you're not under a fluorescent lighting thinking your skin is a lot worse than under your normal lighting at home, because you've taken a picture there and it has assessed your skin. You're like, oh, my skin's so much worse. It may be actually the lighting that is causing these differences, and this app is suggested to balance those variances out. Here are just some screenshots of what to expect to see when you're looking at the apps. These are the ones that I'm looking at as far as the reviews that I just gave. A little bit of information. Maybe you want to take a look at it, maybe you don't, but found them to be interesting. So what validates me to have a sort of personal relationship with acne? Well, my story starts with basically when I was in 7th grade. There was a teacher which commented on the fact that I needed to wash my face. At first I didn't understand what that meant, and as I grew into that year, which was my about 7th grade, I realized that my chin was becoming more and more irritating. I had heard things like toothpaste helps with acne. So when I would be brushing my teeth, I'd actually let the toothpaste wash over my chin. It's a somewhat moronic state right now, but that you don't want to do something like that. You want to try and keep your skin clear and saliva free. So it was all centered around my chin. So it was all basically hormonal for the most part. And my forehead and my cheeks were completely clear. So the summer before 10th grade, I kept experiencing a very oily forehead, and that's when my friend also noticed that as well. He's commented on the fact that your forehead's always oily, and same with my nose. And I began to have more and more agitation about that. So eventually I got started on benzoyl peroxide and clindamycin cream to apply to my chin, and my forehead wasn't necessarily very broken out yet. After 2 months, I discontinued the treatment, and within 3 weeks after discontinuing that, I was on Proactive. So the second semester of 10th grade, my forehead broke out, and basically I had a big pimple on my nose every 3 weeks or so. So I was definitely, no one called me a Rudolph, but people did make comments on the fact that I always got a pimple on my nose. So clearly this Proactive doesn't seem to be working, but I still press on with it. 11th grade started, and then I was still clear basically on my cheeks. I had nothing there, and then as soon as 11th grade started, I started breaking out, and then I also had light redness on my cheeks. I still and never did really have a lot of acne on my cheeks, but I did still get the occasional pimple there. Now the summer of 11th grade, that's when my chest hairs or manly hairs began to develop, and at that same moment I started breaking out a lot on my chest. So 12th grade basically ended my my chest acne, and my chest acne actually got to a point where it was mild. It wasn't severe by any stretch or any real gradient, but it was definitely it definitely held a candle to other people. It wasn't just occasional pimple. I had clustered red pimples on my chest, which one person commented, "Dude, that takes away from your 6-pack. You should really dress that." I'm like, I know, man. So, and it was strongly centered in the center of my chest, but it still spread out into onto my pecs. Now, the summer after, so again, 12th grade, I had remission of these of the chest pimples. So I thought that was great, and I didn't really do anything to get that result. I really just, I didn't use any cream or anything. It just seemed to be happen with age that I had remission of this. That seemed like primarily a development issue, especially with the follicular follicles growing. Now, the summer after my freshman year of college, I shaved my chest and went to the beach. a couple, let's say, some redness developed, and then a couple razor bumps occurred, and then those razor bumps turned into pimples. So basically, I had gotten back my chest acne, but it again quickly went away. I had very, compared to a face where or my face, which had years since I was still experiencing at the time, you know, persistent redness and at least one lesion on my skin. But my chest had come, gone, and then it just went again. So it was very interesting to experience that, and unfortunate. So and it's one thing that made an impression upon me of what you should be doing for your skin and what will basically cause or not cause acne. Now, my junior year, I discontinued Proactive. Finally, I said, screw it. I feel like maybe this is doing more harm than good. And even then, I was doing things like maybe only using the moisturizing cream, and I wasn't using the toner and everything, because I felt like my skin was really drying out and was having a lot of issues. So I discontinued Proactive, and still my facial acne persisted. However, it seemed to become less red. It seemed like I did have some sort of fragrance irritation to the skin. It was like the Proactive did good things, but it also was canceled out by the bad things. It was an interesting relationship with Proactive. Now, first year out of college, I had considerable reduction of oiliness and redness and number of comedones. Now, this is in part probably attributable to the fact that I had a tremendous amount of stress reduction. Now that I was finally not in college, now that I was more free to consume the foods that I wanted to consume, and then I also wasn't working out as much and trying to press on with dairy, and I was becoming considerably more aware of dairy's effect on me. I began to experience reductions. Now, about a year ago, or about a year and a half after I was out of college, I began to having a reaction to mangoes. Now, I had this reaction previously to a much lesser extent, and it just existed on my lips. Now, when I had this reaction, over the course of 3 days, and slowly persisting on beyond that for about 2 weeks, I had redness of the skin, severe oiliness. My lips were crusted and all disgusting and blistered, and I was itchy, and it was a horrible experience. And I did get some more acne because of that. Soon that went away. I had actually a deodorant. So about maybe, let's say, 3 months after this, I had some deodorant in with a thing of zinc, because I began to take zinc probably about a year, or about 3 months before this. And so basically right around my mango reaction, I began looking into things, and zinc was one of the things I began to take, along with vitamin D. Now, so when I had my deodorant in with my bag of zinc, because I lost the container. I used the zinc container for something else. I forget what it was. And then I could smell that the fragrance was now bonded to the zinc. So idiotically, I still took the zinc. And then I realized that I would be getting, I was fairly clear at this point. Maybe just like tiny dots here and there, but nothing that blistered or anything that became a pimple. Upon taking this tainted zinc supplement, I began to have maybe 3 or 4 huge pimples around my nose, 1 or 2 on my cheek or chin, and it took me probably about 2 or 3 weeks to notice the fact that when I took this tainted zinc, that I was actually having these reactions. So eventually I had to remove the zinc, and what was interesting is the fact that it didn't break out just everywhere. It was these huge pimples, and which is different from my reaction with dairy in the fact that I get a multitude of pimples and larger ones, along with more cystic variety. Um, just and not necessarily cystic as in vesicles, but cystic as in just more deep to the skin, more, and so I kind of began to develop an understanding of what was a reaction, what seemed to be more like a facet of your general lifestyle and healthy eating. So basically, it seems to be that high glycemic diets yield to, for me, for a variety of smaller pimples, whereas cystic or deep, larger pimples are more a facet of allergies. Um, and I realized that I'm also very um, allergic to uh, poison ivy, and I found out that pistachios and cashews can cause some disruption and some redness and irritation to me, but not in the sense of necessarily breaking me out, but just agitation and itchiness. So I may start an adapalene treatment, but I think for the most part, I mean, I am virtually clear. On any given day, I could call myself clear, or I'd be perfectly fine taking a photo shoot. Uh, I am experiencing something that was unexpected, but so I have it's either a contact dermatitis or it's something of that nature, and I have also might have developed some mild uh, some some mild rosacea, and so basically the rosacea is basically adhered to the right below my eyes, just on the forward facing parts of my cheek, in that sort of oval area. Aside from that, I have nothing else to show for it. It's not on my forehead, and it's not extensive. Now with the contact dermatitis, or the seborrheic dermatitis, the dermatitis, or however you want to, whatever you want to diagnose me with, which I'm not 100% certain of quite yet. It's basically crusted flaking on my skin, generally above my lips, and then a little bit on my the below my chin, just on the right hand side of my chin. So again, that's up on my lips, and then on the right hand side of my chin, and that varies in severity, um, and it does limit when I'm considering maybe shaving, and that's really something that has been difficult for me to diagnose. I'm trying to use the methods that I've used to find my allergies for um, acne, but this is a very tricky issue where I'm doing illuminations, not experiencing issues, and then maybe it's an environment thing like humidity, and then all of a sudden I'll have itchiness, more severity of the issues, and increased reddening. So I'm progressively using my methods and to try and target this issue, and it's kind of disheartening because I've done my acne is virtually gone, but I have these other issues that are lingering, and that's something I've also talked about. Is that, I mean, someone with severe acne may be all excited to have clear skin, but it's not like they're going to look like a model because they could have some other issue that arises. Lastly, I do have dandruff to a pretty considerable extent. I would say it's mild though, mild to medium, and that's also aggravating. And I do also just have general flaking of my skin, but that really only is experienced directly after a shower, and after taking a wet paper towel and wiping my face down, it basically removes all of the loosest parts of the skin in it, and I look halfway decent. So that is my story, and I have another slide for you. So this is my other slide. It's basically my acne timeline and how my acne relates to periods of my life and basically my age. And as you can see, 10th grade is, I would judge it to be my worst. And I don't have all of the pictures to back this up, but I do have moments of my life and knowledge of my events to suggest that my acne is most severe around 10th grade and gradually declined despite the experienced stress in college and added drinking. It seems that 10th grade, which is consistent with the research, is was my worst time. Roughly about 16 years old is your worst time as a male, and I think it was about 14-year-old for a female. And I made that statement previously, and I would like to refer you back to that if I've made any mistakes. So this can maybe give you some expectations. Now, as far as my scale of severity, as you can see, on a 1 to 10 scale, I was at like an 8. The only thing that would have brought me any higher would have been actual cysts, which I really didn't experience much of, thank God. I don't have any scarring. I've been very lucky about that. I am not sure why I haven't experienced any scarring, but I'm basically scar-free. I can't recall anything that is giving me any sort of issue as far as scarring is concerned. I think I do have a little dent in my forehead, but I think that was from chickenpox when I was like 5. So as you can see, I say I have about a 3 here, but if I update this, I would honestly call myself maybe a 1 right now. I've really I really don't have any acne as to speak of currently, although when I do switch my diet, I can experience upwards of a 2, 3. I never really get to something where I have unmanageable acne at this point in my life. I am currently 24 years old, and remember that about 90% of people, the vast majority of people, males I should say, after the age of 25 are acne free. I think it's only about 20% of those who've had acne that it still persists in. So, and that number definitely does vary from study to study, but it still shows that there's a significant age relationship. And it also, holding to that thought, the adult onset acne is increasing amongst the population, but it is primarily increasing within the female population. So now you possess substantial information and knowledge about acne. And so much so that I believe that we can begin to understand and assess research initiatives to see how well they are, basically to see if the direction of our community, our academic community, is matching with the thought processes of the patients. So there's one which is what management strategies should be adopted for the treatment of acne in order to optimize short and long-term outcomes. Now, that's a very broad one, but it's one that I think everyone can agree on. Now, these aren't made up by me. These are actually, this was an initiative that surveyed a community that visited this website, and they basically put in their questions. But I feel like they're somewhat more geared towards healthcare practitioners than they are the patients themselves. So what is the correct way to use antibiotics in acne to achieve the best outcomes with the least risk? A question like that I feel like is geared towards healthcare practitioner, not necessarily the patient. But 3, what is the best treatment for removing scars? 4, what is the best way to preventing acne? Those are very patient related and practitioner related. Now, the correct way to use oral antibiotics, or oral isotretinoin I should say, in acne in order to achieve the best outcomes with the least potential risk and serious adverse side effects. Which lifestyle factors affect acne susceptibility, severity the most, and could diet be one of them? I think 6 is a very predominant question and better relates to 1 than I think is being taken on, and I think it's something that patients are very much focused on over some of these other ones. And if you're going to say something like 4, I would say 6 is much higher up there, because it's basically it's the action of 4 in part. Now, what is the best way of managing acne in mature women who may or may not have underlying hormonal abnormalities? This one is a growing concern, especially because of its later stage of development. Generally, women in their 20s or so. This can cause, or even later in the 30s, 40s. This can cause a greater amount of concern because of the stigma that is revolving around acne, and the idea that you basically can't just age out of the condition. So that's definitely a very high focus for many individuals. What is the best topical product for treating acne? Which physical therapies, including laser and other light-based treatments, are safe, effective in treating acne? How long do acne treatments take to work, and which ones are fastest acting? I mean, a lot of this is geared towards what I'm hoping occurs, but it doesn't have the specificity I'm looking for, in the fact that we need a reevaluation and an analysis of our acne treatments and validating them. We have some studies that basically there isn't a whole the level of evidence is not very high, and it's not necessarily proven. Although studies have come out, they've been supportive, it's not proven. It needs more validation, more similar studies, if not mirrored studies, to see if they get the same result in a variety of subjects. So, and they need to be bigger. We just don't really have the volume of research that we need. So we need basically more dollars in acne research, along with the right sort of specificity, and we need to be concerned about whenever a new acne remedy is introduced, because it adds in more variables and things that we don't necessarily understand, and they also have to pass tests, like just because it has you could put a moisturizer inside and put anything in it, and then it would benefit the skin. So because new medications and new studies come with a lot of flaws or potential oversights, we need to make sure that the ones that we have are as solidified as possible. I'm not saying that we need to stagnate our research on new treatments, far from it. However, I think doing things like evaluating lifestyle changes, like reducing glycemic index, like improving or reducing milk consumption, like basically supporting stress levels and reducing them, and helping sleep, we'll see much better results than trying to look for the next pill. I would like to see some mention of a probiotic or that sort of route. How maybe a question or a hopeful quest to find whether or not probiotics, either topical or oral, can benefit the skin, and more validation of that. But are these in line with what you're hoping for? Are these in line with where you think, if you were to give a researcher $100 or $1,000 or $10,000, and you wanted them to find a cure, and they were selecting out of these answers, is that something that you'd be okay with? Which one of these do you feel like is the best? And often, though, when you're trying to consider the best, sometimes you consider the broadest, because they're answering a variety of questions. But if you look at research, they're answering usually very specific things. Does this affect this in this population at this period of time for these individuals. So you also have to look at that as basically, is something like that reductionist approach also okay, or do you need something that is more broad-based? Do you want a meta-analysis, or do you want a systematic review, or do you want somebody to go out into the Amazon rainforest and find a new botanical um, ingredient? So basically, you're paying for their travels and their research and their escapade. Is that something that's okay with? Even if they come out with nothing, the research could be moot, but we still haven't proved anything yet. So basically, what I'm saying is you need to consider yourself right now as a scientist that is trying to cure yourself and also help fund the research initiatives. So Acne PSP, or Proprietary Settings Partnership, is a research initiative started in 2013 by the Acne Academia in collaboration with James Lind Alliance. So there is a strong motivation for certain people in this organization to cure acne, and this seems to be one of the primary ways you can fund research. Aside from something like a crowdfunding website, where you could get a specific question answered, I would say if there's going to be anywhere you want to send your research dollars to, as of right this moment, this seems to be the best one. So there's two things about this slide. One, you're trying to consider what you should maybe take on, what you should read, what studies do I need. Although I will gradually be adding in all of the backed research that I have, I'll be citing everything. It's pretty labor intensive, and I want this out as soon as possible, so I can't do that at the moment. Now, I can offer you two very broad-based and comprehensive acne books. So there's Acne and Its Therapy and Acne Vulgaris. And if you're looking for maybe the best acne healthcare practitioner, the best person to solve acne issues, maybe someone who wrote and authored and edited these books would be that person. So Guy E. Webster, that maybe he's in both of these books here. I would say that he is probably one of the top resources for acne research. So if you're around him, I would say maybe you should give him a call. So there's a growing number of people to thank, but the ones that I need to thank most, I believe, are the people who provided the diagrams and visualizations. I would also like to thank Acne Practice. I would like to thank Dr. Najib, Kevin Hem, Armando Hashirgan, the journals and authors, and also a special thanks to the YouTubers and for your reviews and your stories and your honesty. I wish you the best of luck in clearing your skin, and may the clear skin be with you, and happy researching.